Are you stuck inside from weeks of quarantine, feeling out of whack, or slowly forgetting what day of the week it is? Maybe you, like many others, are resentful that the beautiful spring weather appears as soon as we're told we have to avoid public places at all costs for the greater good of ourselves and our society. Maybe you're starting to question why we're taking extreme measures to prevent the spread of coronavirus and wondering, what is coronavirus anyway? And I'll help to answer some of those questions. So what is coronavirus? Well, coronavirus, also called COVID-19 or SARS-CoV-2, is a virus which infects the human body by entering healthy host cells and replicating to spread the infection throughout the respiratory tract and the rest of your body. It typically causes an immune system response within 14 days of infection, with early symptoms like sore throat, fever, and dry cough. As COVID-19 spreads down the respiratory tract, it can inflame the bronchi, or your windpipes, and your lungs, making it difficult to breathe and potentially leading to pneumonia, which is an infection of the lungs. In the worst cases, the infection can lead to dyspnea, or shortness of breath, which may progress to acute respiratory distress syndrome, known as ARDS. This puts the patient at risk for respiratory failure and can ultimately have fatal outcomes. So knowing the potential for its adverse impact, what do we do about coronavirus? First, we should recognize that there are four main types of pathogens. Bacteria, which are prokaryotic single-cell organisms that can be fought with antibiotics. Fungi, which are eukaryotic cells with thick cell walls that commonly grow in many indoor and outdoor locations. Parasites, like protozoa, which feed on their host and are common in tropical regions. And lastly, viruses, which are made of a piece of DNA or RNA that are protected by a protein coating. Viruses use host cells to replicate, damaging and destroying infected cells along the way. And because COVID-19 is a viral pathogen, it can't be killed by antibiotics. But we can slow the spread of the virus so that our hospitals and healthcare systems don't get overwhelmed by having too many patients to treat at one time. Like other pathogens, coronavirus spreads through the chain of infection. For an infection to be transmitted from one person to another, there needs to be a host, like a human host, an infectious microorganism, a mode of transmission, and a reservoir, which is any site the infection can live, including people or inanimate objects. Scientists have determined that the most common mode of transmission for COVID-19 is through droplets of saliva or mucus that are expelled by coughing or sneezing. We know that soap is able to lyse or break the host cells infected by the virus, and cleaning solutions like Lysol can kill the virus. With this information, we're well equipped to break the chain of infection. For example, we can practice social distancing by avoiding large gatherings and staying more than 6 feet apart from one another, separating human hosts from one another so that the infection can't spread host to host. We should also avoid coming into contact with fomite surfaces, which are inanimate, non-living surfaces where the virus can live temporarily. We should also avoid touching our own faces, wear a mask and gloves when leaving the house, and wash our clothes after returning home to kill the virus. But what about healthcare workers and clinicians? Are there ways they can help prevent the spread too? Of course. As always, standard precautions to prevent infection control should be followed by clinicians. This involves proper hand hygiene to kill the bacteria with soap and water before and after coming into contact with any patient, donning the appropriate PPE or personal protective equipment like gloves and mask before interacting with patients, and reviewing the full guidelines on standard precautions. Furthermore, because we know that droplets are the primary mode of transmission for coronavirus, droplet precautions should be taken for patients who have tested positive. These patients should be isolated in their hospital rooms so as not to come into contact with other potential hosts. Masks should be worn by providers within 3 feet of interaction with patients who are tested positive, and the patient should wear a surgical mask should they need to leave the room. Special attention should also be paid to cleaning surfaces like door handles, bathrooms, countertop surfaces, and other fomite surfaces that patients and workers come into contact with. All of these efforts will help clinicians prevent the rate of nosocomial infections, which are infections acquired inside the hospital. So now that we know the basics of COVID-19, what it is, and how it spreads, and what we can do to minimize its effect, let's act together and slow the spread of infection.